Hi, Mike Gibson, Robert Mentz, coming to you live from AHA 2022. And we're talking about the Transform trial. Talk to us a little bit about why you did the study, how you did it, and what you found.
Perfect. So we were really interested in this foundational question in heart failure that comes up every day in clinical practice. The idea that data support there might be benefits with Torsemide as it compares with Forsumid, but they've never been compared directly in a large randomized trial head-to-head.
Right.
So it was a really foundational question, and we wanted to determine the answer, and that's why we designed.
That's why we do trials.
That's right.
Yeah. What was some of the reason behind, the purported superiority of Torsemide?
Wonderful. So most commonly what you'll hear on clinical rounds is it's better absorbed even in the setting of gut edema. But importantly, there are important pharmacologic data that suggests a longer half-life, so really a longer duration of action. And then you combine that with data that suggests anti-aldosterone and anti-fibrotic effects, similar to some of the other evidence-based therapies like MRA use in heart failure. And then observational data has suggested that maybe in that context, it actually reduces clinical outcomes as well.
So you randomized people. How many? How long? What did you find?
So it was 2859 participants, a diverse group, 37% women, 34% self-identified Black individuals, recruited from 2018 to 2022, so earlier this year. We followed them for a median of 17.4 months following their initial hospitalization, and we found for the primary endpoint of all-cause mortality, similar event rates in both arms. So a neutral primary endpoint for all-cause mortality, but a very high event rate. 26% of the patients died during a median follow-up of 17 months.
Wow, that's amazing. That's amazing. Were you surprised by that number?
We were, and it's some of the challenge of, as we design these pragmatic trials, understanding by having broad eligibility criteria, we have patients coming into the trial that are usually not included in programs like this. So the trial was actually initially planned that we were going to recruit 6,000 patients, but events accrued faster than even anticipated. So a smaller sample size, and while neutral for both the primary endpoint as well as a composite with hospitalization, we'll have important data coming out around quality of life. We have ancillary studies that'll take a deeper dive into biomarker data that'll help get a better sense around some of the other clinical implications.
So what's the take-home message for docs?
The take-home message is that in terms of all this prior data suggesting potential benefits with Torsemide, no difference in clinical outcomes in patients like were in Transform, so those recruited in the hospital. So what do we need to do? We need to use that clinical time, not talking about switching diuretics, but have patients on the right dose to get their volume status as good as possible, and spend that time focusing on initiation and titration of medical therapies that improve outcomes.
Well said. Thanks for joining us today. And thanks to all of you for joining us here live from AHA 2022.